From the News Channel 5 Network, this is Morning Line with Nick Barris.
Good morning, everyone. Thanks for joining us on Morning Line on this Wednesday. I hope you are having a good morning, and I'm glad you're here. Listen, we're going to open up the phone lines in just a moment. The topic of conversation this morning, we're going to cover a broad range of topics, but several cities across the state, and there are folks who want the governor to take steps. But here in Metro, of course, the council is going to decide whether or not to reinstitute a mandate for masks indoors. And several physicians and others signed a letter to him asking, about whether or not he could reinstitute that as we see the COVID-19 spike, the way things are going right now with the Delta variant. Other questions with regard to COVID we're going to talk about this morning, just where you can wear masks, maybe some questions even about vaccines, what happens when someone makes their way to the emergency room with a situation with COVID with our guest this morning. And before I introduce her, I want to let you know that we're not only on the Plus today, but we're also streaming live on Facebook at newschannel5.com. So I'll have a computer here, and you're welcome to join in the conversation. If you post some questions there, I'll be monitoring it as we make our way through the show and ask those as well. So you can ask questions. You see the number on the screen. With us this morning is Dr. Katrina Green, joining us by Zoom. It's good to have you with me. Can you hear me all right, Doctor?
I can, thank you.
Okay, so you're an emergency room physician. Let's lay this out. So do you work, I think I see here, in both Nashville and sometimes you spend time down in Lawrenceburg?
Yes, I work at both places right now.
Okay, and you were among those who signed a letter to the mayor asking that he, in Metro, reinstitute a mandate for masks indoors.
Yes, I attended the Metro Department Board of Health meeting. It was September 9th, and I sat in and listened to the debate amongst the different board members whether or not to institute a mask mandate at that time, and was just very disappointed that they didn't do that at that time. So I decided to start a petition, and I knew there were others that felt the same way, and clearly a lot. We had, I just checked today, 903 other people signed my petition, which we delivered via Zoom press conference yesterday. And one of my colleagues is printing off a paper copy of it and sending it to the mayor's office today.
Gotcha. All right. So I know that's something the council will consider. I want to hit this right off the top. It looks to me like you are at home, you're wearing a mask, and you're alone there, it looks like. So people may say, wait a second now, do you really need to wear a mask when you're home like this? And I don't know if you're alone or not. Maybe you can explain, because actually I learned before the show why you're wearing a mask.
Yes, so it does seem silly to be wearing a mask in my own home. If I just lived by myself, or if the situation was different, you would be seeing all of my face. But my husband tested positive for COVID-19 on Friday. And so I'm doing everything I can to keep from catching the virus so that I can keep working and keep from overburdening my colleagues even more than they already are. We've had several physicians who've had breakthrough infections, and it just makes it hard when we all have to pick up the slack and work extra shifts to cover that doctor when they're out sick. So I'm wearing this mask. My husband's wearing his mask. He's currently sleeping upstairs, and we mostly hang out outside. Luckily, the weather hasn't been too hot, so it's been fairly comfortable to do that. So we're just trying to be safe and keep me healthy. Luckily, his symptoms have been mild. So, we've been very blessed. He is fully vaccinated, so he counts as a breakthrough case. And with that protection from the vaccine, it's likely why he doesn't have worse symptoms.
Well, that is good to hear. I'm glad to hear that. And if you would, it's been talked about ad nauseum. There are some still who have questions about it, don't understand or object one way or the other. But from the medical point of view, with regard to masks, I was asking you, for instance, I'm thinking of going to the Titans game this weekend. I've been very cautious about whether I go to areas where there are large crowds, especially that are going to be unmasked. When you wear a mask, I've heard time and again that primarily is to maybe protect others around you should you maybe be infected and not know it, or something along those lines. But if you're wearing it yourself, can that also, to what degree, provide a level of protection for you? I want you to just recover that for us.
Sure. I mean, I couldn't tell you the exact statistics of how likely you are to breathe in, virus particles from others around you wearing a mask, but studies have shown that wearing masks does decrease the spread of the virus. There's multiple studies that have been performed since the pandemic started. I mean, at the very beginning, we didn't know. This was a brand new virus. The science was new. And so, everything was a work in progress. And so that's part of the reason why at the beginning of the pandemic, scientists and doctors were not saying we needed masks, because we didn't know that the virus is airborne. It spreads very easily. It's not just droplets, it's in the air you're breathing. So if you're next to someone who has COVID and they're breathing, you're going to be inhaling that air. And so a mask keeps you from inhaling that air. It kind of filters out the particles. The KN95 that I'm wearing is a very good mask. It's relatively cheap. It's available. I bought these masks on Amazon. And there's multiple companies where you can buy these. These are probably the mask that I would recommend the most for public right now, because they're more effective than the cloth masks and just the surgical masks. It clearly fits my face very well. There's no air getting in around the sides or around my chin, things like that. So the mask, it protects you. But yes, you're right. It protects others around you as well. And during a pandemic, we need to be looking out for each other. We're all in this together. I don't want to infect anybody else as much as I don't want to get infected myself.
You work in the emergency room, correct?
Correct.
Give me an idea of what it's like in emergency, what you have seen with regard to COVID patients who have come in. And I guess, they can arrive at a hospital a number of ways, not always through emergency. But when they do, and also give me a sense, I have a nephew who's an emergency room physician in Texas, and he says to date, and he's seen plenty, he's seen an awful lot, but he says he has yet to see someone come through the emergency room who has been vaccinated and is sick, who did not have some pre-existing condition to some degree, where it got to the point where they had to go to emergency. Most of them that he's seen are unvaccinated, or they are folks who had breakthrough cases that were vaccinated and had a pre-existing condition once they got that put them at risk. What have you seen?
So exactly. I just on a shift last week, I had two different patients, roughly the same age, same medical conditions, COPD or a chronic bronchitis that results from smoking usually. Sometimes it can be genetic. One of them also was at the point where his disease had progressed and he needed to be on home oxygen. The other patient was not yet to that point in her just general health. Now, both of them came to my emergency department, very short of breath, working very hard to breathe. One was vaccinated, one was not vaccinated. One of them I was able to treat from the emergency department, felt much better, and went home. The other patient was critically ill and needed to be admitted to our ICU. Guess which one was which?
Yeah.
The vaccinated person, I was able to safely discharge from our emergency department, had a normal oxygen level, and was feeling much better. The patient that was unvaccinated with that risk factor was very critically ill. And I don't know how that person is doing. I hope they are getting better. But that's something that always worries me when someone is that sick is, did I just admit a patient to the hospital to die? And the vaccine prevents people from getting that sick. There was a drastic difference between the two cases that day.
I've seen reports from other emergency room nurses, and they say that there are times when some of those individuals who come in and realize all of a sudden they're very sick, they beg for the vaccine. And you have to explain to them, right, that it's not the way it works, it's too late.
Exactly. And that's heartbreaking. I want everyone to be healthy. That's my job, is to take care of people and do my best to keep them healthy. And when you've already come to the hospital with COVID, and it's just too late at that point, you need to get the vaccine before you get sick.
It's
a preventative measure.
Sure, and that beforehand, that's the whole idea. You get it beforehand, build the antibodies, and it protects you. And some of these other treatments, I wonder if you've encountered this. I've had people message me and say, Nick, I live in an area where there's a doctor and a hospital that's treating my loved one who's very sick, and they refuse to give him or her ivermectin. And I don't think that's right. Why aren't they giving him ivermectin? And I've responded basically saying, ivermectin is not approved and proven to work in this case. And they cite that NIH study that, if you really do read it, makes it very clear if ivermectin has any effect on COVID, it requires about 100 times the dose that a human body can handle anyway. And I get responses back like fake news, and they just refuse to believe it. And they're angry that physicians at some of these hospitals, when they're asking them and they see a loved one very sick, aren't giving them ivermectin. What would you say to that?
If ivermectin worked, I would be giving it to everybody. I would be throwing it around like candy. I'd be ivermectin for everybody, like Oprah. You get ivermectin, you get out. Mm-hmm. But none of the studies that we have thus far have shown that it provides any benefit, and it can cause harm. And the worst thing that a physician wants to do is cause harm to his or her patient. We got in this business, this field, this career to make people better. We don't want to hurt people. And the science that we have right now shows that ivermectin can cause harm and does no good to treat the virus. So, and I think a big reason why people are upset and want us to push this medication that, we don't have any science that shows it works, is because the politicians are sticking their nose into the medical field. And so they've made it, political. And we have certain Republican governors and other leaders that are saying, give ivermectin, it'll make it treats everything. It doesn't. Leave the science to us, doctors and scientists. Do your politics. I don't know much about politics. I totally defer that to them, but let us do our job and stop trying to do it for us.
Yeah, exactly. And that's real news, not fake news. As we go to the break, I can share a personal story. A good friend of mine, her father-in-law, from the very beginning said, don't you dare get that vaccine. And I think it was politically coming from that. And he was a veterinarian who was ingesting large doses of ivermectin thinking that would protect him. He ended up getting COVID. He's dead. We'll take a break. We'll be back with more calls and comments on Facebook as well right after this.